Testing. Dengar tak?
Dengar. Tapi bergema.
Oh,
Hello, Dr. Azwani setengah.
Assalamualaikum.
Waalaikumsalam.
Testing. Hello.
dah. Main dah disable dah. Sorry.
Testing. 3. 1, 2, 3. 1, 2, 3. Suara saya.
Hello. Testing.
Dr. Azwani ada echo. Doktor ada echo. Dr. Azwani. Hello. Doktor ada echo lah.
Tahu.
We know. We try to rectify. My voice is okay?
Okay, Prof. Saya dengar okay.
Okay.
Testing.
Sekarang ni speaker kat siapa ni? Speaker satu je kan patutnya.
Tak ada speaker. Headphone. Ini pakai yang top-nya.
1, 2, 3. 1, 2, 3.
Testing. How about the others? Can you hear me?
Boleh dengar, Prof.
Baik. The output for the speaker is
Assalamualaikum.
1,
Boleh
2,
dengar
3.
saya?
1, 2, 3. 1, 2, 3.
Boleh dengar tak saya?
Boleh.
Boleh
Saya dengar.
Alright.
1, 2, 3. 1, 2, 3. Testing 1, 2, 3. Testing.
Macam mana kalau nak stopkan bunyi tu?
Testing. Pakai mic.
Participant kan klik ni invite, kenapa kalau tekan ni? Oh, lepas tu dia ada ni. Dah play sound ni saya dah off dah. Tak ada tick dah, antik dah. Host saya dah ni dah. Sebab tadi kan masa dekat sana, dekat dalam meeting room, bila ada orang masuk dia bunyi tau.
Jadi
Prof Zam, can you say something? Just testing.
hello. Assalamualaikum. Can you hear
Okay.
me?
Good.
Testing.
Hello.
Testing. Dah, boleh. Okay.
Okay, dengar.
Can somebody talk so that I can hear through here?
Okay, testing. 1, 2, 3.
I can't hear. I can't hear your voice, Prof. Cuba diri cakap. Nope.
Yeah, put it on off the TV.
Diri.
Testing 1, 2, 3. Testing 1, 2, 3. Tapi speaker yang dah tak ada lagi kan bunyi. Good.
Okay, testing. I hope you can hear me now. Okay, okay now. You can start.
Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon to our Honorable Dean, invited speakers, respected lecturers and participants. Welcome to this afternoon's forum on research medical mentorship, which is organized by the Office of Responsible Research and Innovation. Before we begin, let us start with the recitation of Surah Al-Fatihah. Now, I would like to invite Prof. Dr. Jamaluddin bin Abdul Rahman, the Dean of Kuliah of Medicine, to deliver his welcoming remarks. Please welcome.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. First and foremost, I would like to congratulate Dr. Ruslina and the Office of Head of Research, as well as the moderators, Dr. Shahidah, Dr. Azwanis, for agreeing to participate in this, I think I will say, inaugural kind of session that we plan to enhance our experience in research. So one of the difficulties and challenge, especially for us in medicine, is to balance the need for service and the need for research. And we have to take note that for scholars, for people to share their knowledge and wisdom, is none other than to have some, to answer the inquiries or to answer the questions that they have in running, in doing the daily task of their life. So we know the scholars in Islam because they share their knowledge, they do the research, they publish, they write. Because of that, we know about their achievement. Similarly, in medicine, for our practice, we need all those things. We need to learn, we need to practice, and during our practice, I believe we have questions. We have a desire, we have aims to improve things in our life. So because of that, we need the skill to do research. And the other challenge that we face, especially the young lecturers in our kuliah, is to find time and to plan their time properly. How much time can they dedicate for research when at the same time the need for service, for example, in hospitals are required. So these are the things that I believe why we have this forum. And we plan this as forum because we have a senior researchers, senior lecturers in the kuliah. And we do have at the moment, for your information, so many young and talented lecturers. And the ratio is very alarming. If you look at the ratio of staffing in our kuliah, we have so many young. Kalau in demography, for example, in demography, if you learn about demography, as if our population growth is like expensive model, expensive curve. We have very broad base. We have so many young lecturers in the kuliah. And for me, I consider that as a strength of our kuliah. And we have to treat this opportunity as a gold mine. So that together, inshallah, we use your desire, I would say, your energy, so that we together, inshallah, we can benefit the people around us, benefit our patients, benefit the ummah. I think I would like to further delay the forum. So with that, I thank again Dr. Roslina and the team, the moderators. I told Shahida and Azwani, make sure you ask difficult questions. They said that they already reviewed the questions. I said create new one for the speakers. I think that's all from me. Thank you again. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. We thank you, Prof. Let us first introduce ourselves. I am Dr. Azwanis from the Department of Family Medicine.
I'm Dr. Shahida from Department of Internal Medicine.
We are the moderators for today's exciting forum on research mentoring.
Before we begin, there are few housekeeping announcements. Number one, please fill up the attendance form that we put in text box. Also scan the QR code and then fill up the feedback form before you leave the event. And if you have any question rise, you can put on chat box and we will go through it during Q&A session. Thank you.
Shahida, sorry to interrupt.
Yes.
Suara echo.
Oh, okay. Okay, noted.
Okay. Dear participants, research is such a broad field and requires skills, knowledge, and experience. That is why many new lecturers feel lost and uncertain when asked to take up the role as a researcher. Yes, we all had to undertake a research project during our masters, and though it did give us the basics, but we still feel unprepared and overwhelmed. So this is the purpose of today's forum, to hear the research experiences of 4 accomplished senior academicians and to understand the importance of research mentoring.
Let's start Let's start introduce all of our speakers today. So we have 4 distinguished speakers. Number 1 is Prof. Nolelawati A. Talib. So she is a clinical hematologist and also a head of Department of Pathology and Laboratory Medicine. She has successfully published extensive research and she also has interest in epigenetic and complex disorder. Second speaker is Prof. Dr. Hao Sun Hin, which is well known to us. He is a chest physician. He has interest in myelidosis and lung cancer, published about more than 60 papers, local and internationally.
Our third speaker is Associate Prof. Dr. Nur Zamtila Abdullah. She is a chemical pathologist from the Department of Pathology and Laboratory Medicine and has managed to secure grants at university and national levels where her focus area is on cardiovascular disease. Our final speaker is Prof. Datuk Dr. Muhammad Basri Matno. He is the head of the Department of Anesthesiology and Intensive Care. His research area is in intensive care unit and has multiple international research collaborations and publications. In MyRA 2020, he ranked 2nd in Kuliah of Medicine and 14 in IIUM.
Without further delay, I would like to call upon our first speaker, Associate Prof. Dr. Nolela, to enlighten our participants about how to get ideas for research.
Assalamualaikum warahmatullahi wabarakatuh. Rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahu qawli. Thank you, Dr. Shahida, Dr. Azwani, for the kind introduction. I'm not clinical hematologist. I'm a hematopathologist. Basically, the topic given to me is how to get idea for research. A bit echo, All right. First and foremost, I would like to make a declaration. I might not be the best person to talk about this. I just hope that I can offer some helps, especially to young academicians, at least how to start doing research. I think it's quite simple to get ideas for research. I think I just lay down three steps. The first step is to identify your research areas of interest first. Because if you don't identify your focus or your focus of research or area of interest, you might not be able to actually go further from that. You need to identify where. For that, you can get some ideas. All right. And then to identify your research focus, you can actually expand from your previous PhD study or your previous master thesis or dissertation. It's up to you. Some people would like to expand from their previous master thesis. Some start new. Me myself, I start from. I don't want to do something where it's the areas of interest of my supervisor. So I'm doing something new. It's up to us to decide actually. It's just that first and foremost, you need to decide whether you want to do, you want to do something like clinical research, or you belong to basic science research, because I think the participants are from these two sections. Because it's also important for you to decide, because clinical research is different than basic science research. For basic science research, it's more specific, it's kind of elaborated, kind of a bit elaborate, and the key person that you may need to engage later probably different. As compared to clinical research, though it's also experimental, but you can also start with some kind of simpler research, something like observation research, prevalence, things like that, which is quite easy. But it may take some time to actually finish the research. So the clinical research and basic science research are a bit two different entities. But my advice is for young lecturer, why not you actually hybrid both? Hybrid, doing some clinical, but with some kind of basic parameters into the research. I'll give you example. For example, your interest in nephrology, for example, and knowing that the chronic kidney diseases is very rampant, attribute to hypertension and diabetes, right? So basically, you can get quite ample of participants. The sampling probably not really difficult for you all. That's the first step. But the second step is how to integrate basic parameters or basic sciences into this. Perhaps you just Google or be updated with few new markers of early kidney injury, something like that. Or perhaps you look into response of erythropoietin, and instead of just looking for the HB level, perhaps you just may need to look further than reticulocyte level. You may look for the early reticulocyte count, intermediate reticulocyte count, and so on and so forth. Basically, what I'm stressing here is actually, why don't you try to integrate the so-called clinical research with some basic sciences parameters, which is yet diagnostic, but it can be also useful for what you call this clinical research. I think that will be more helpful and give better impact rather than just repetition study. I think that's kind of what I want to say about the you need to identify your research focus. When you identify your research focus, you may able to identify key person to help you doing the research. For example, for basic sciences, if you want to do something which is experimental, where you need to engage people with, for example, metabolomics knowledge, people with knowledge in proteomics, then you can actually identify those person. I'm just worried that you do not know those person, but frankly speaking, I think in Cotton campus, there are quite a number of individuals that you can ask for help. Right? For example, in metabolomics, I think there are a few lecturers in Kuala Pharmacy very expert in this field. And then proteomics, yeah, as well as molecular study, for example, there are many people that you can engage and help to help you to actually in that kind of research. That's the first step, identify your research focus, and then you can identify the key person to help you in research. And I think the second step, which is very important, is actually how to get yourself, know how to get yourself updated with knowledge. And I think there is the generic answer is you need to read lah. Read what kind of materials. Generic answer is journals. But you can to get research gap is there is no way to get research gap unless you read that the answer for that. But when you get the gap in knowledge, then you know that that will be your research gap for you to actually get those as a basis of your research. I always say this to my student: if you're not sure how to get the research gap, at least you just read review articles and go at the back of the review article. There will be conclusion, there will be limitation. That will be where the authors actually discussing about the limitation and gaps of previous research. That is the best, the easiest way to get research gap. In a simple way to get research gap is also by if I don't think people read journals nowadays because we don't have time. A simple excuse, we don't have time. Do you read abstract? Probably we also don't have time. But at least you can read scientific newsletter. Right. I think, for example, science newsletter, because it summarizes new discovery. Right? Science newsletter, it summarizes new discovery that you can actually get those as We don't have to actually Google, go to PubMed to look for the recent papers, but those newsletters sometimes give you the updates of current things that you can actually get those into your research focus. That about the how to get how to be updated with current knowledge. And all right, I think those two are, but I think finally the last is the requirement is ideas comes when we have basic knowledge, especially in statistics, because sometimes we can modulate the ideas when we see the bias of the methods of study. So I think we have to be, we have to educate ourselves and be, I think, at least in terms of different methods of study, at least in terms of how to get a reliable, meaningful sample size, and how different form of basic statistic. If we can actually, if we have those kind of basic understanding, we can actually get ideas from whatever papers that we know they are biased, their limitation, their weakness, and we can actually improve and formulate different studies based on the bias or the weakness of that particular study, and that can be part of our study. All right. So I think before I end, I just very short. Before I end, you just my advice is just, yeah, you need to read. That's first. You need to identify your focus area. You need to identify a person that it can help you, but that's not necessary. It's not mandatory. You can also start something without the help of others, because especially to clinician, the data patient is just around you. You can actually formulate something out of those data, and then write something. The gist is to inculcate the research culture is first and foremost. You need to do something to get you used to write. If you have you have the what I call the what I call the sweetness of writing, and the subsequent research will be easy. You just want to write. You write and then you write. That the first thing. I think that's the point that I want to deliver. Back to the moderator. Thank you very much.
Thank you so much, Rolela. So it seems that we have to read a lot to get ideas, isn't it? Yes, we do a lot of reading, isn't it? Okay, never mind. The next question is actually to Prof. How. It's actually related to what Prof. Lila was saying, is that we have read and so many times over, but how does the passion comes? Prof. How, can you please clarify or elaborate to us, how do we do research passionately?
Hi, good afternoon. Thank you for your questions. So I'm actually preparing something in the slide presentation. Let me share my screen. Can you all hear me? Because I think the internet here sometimes got problems.
Yes, we can hear you clearly, Prof. Very
okay.
clear.
Okay, good afternoon. I was given this topic. I actually thinking about what to tell. So are we going to talk about this clinical research definition? What are the basic research? And then why we do research? Is it because our passion or what? Is it to improve medical knowledge? Is it want to save more life? Or is it want to improve quality of life for the patients? Or is it just basically for promotion so that we get professor later on? I'm not sure. And I don't want to give you another lecture. So what I want to do is just want to share with you my experience and how I start my research. And you know that some of you know that I'm actually particularly interested in melioidosis. Why? Because when I first came to Kuantan, so I find a lot of patients with melioidosis die. And in fact, so there's not much of Malaysia data at that time. So we actually did a retrospective study, and then we found that the mortality rate of melioidosis about 50%. And we found a lot of doctors, they don't know how to treat melioidosis. Sometimes they diagnose, oh, melioidosis plan, give cloxacillin, or they just choose any antibiotics that is sensitive to, like for example, Zinat or etc. Nobody give proper antibiotics. So with that, I actually worked with Datuk Sapari, the head of department at that time. So I said, why don't we have a lung melioidosis registry in Pahang? So with that, with a few objectives, actually is to create awareness among doctors, and we train them. So I actually went and do roadshow to a lot of hospitals, and then we also at the same time collect more data to see whether there's any improvement. And we wrote a guideline as well on melioidosis, how to diagnose and how to treat. And whether you need research grant for this, and I hardly get any research grant for this. And I think to us as a clinician, a lot of time to get research grant to do clinical study, if you just do based on the patient cohorts, usually you will not get grants. Unless you do some molecular tests or basic medical science research, work with our scientists here, then most likely you're going to get grants. And so I would suggest for the young lecturer, those who are in the clinical department, what you can do is you can have your own disease registry. You can think about, like Laila said, that which disease you are interested. If you're interested in chronic renal failure, you can have the chronic renal failure registry, but you can study on certain things that you are interested, like for example, in this case, I'm interested in mortality or melioidosis. So then from the registry, we found out actually, well, there's an improvement after we do some works. A lot of patients now treated with appropriate antibiotics, and the relapse rate is also lower. Somehow the mortality is still about 40%, it's still very high. So how else can I improve the mortality of melioidosis in Pahang? So we did a study, look at how about the role of PCR. So we look at patients with pneumonia that come to HDAA, and we find actually melioidosis is the third commonest cause of pneumonia actually in Pahang, and most of the cases are diagnosed by PCR. So PCR is very important. That's why over the past few years, I've been trying to tell HDA, even I actually talked to Leila before, so probably we should do PCR for Burkholderia pseudomallei. Somehow, melioidosis is very difficult to diagnose just by culture. So we probably need to do some molecular tests. How about serology? A lot of people send serology, but from our study, it's actually found out the background serology is actually very high. So 50% of the adult actually have positive serology. So I think there's not much of a point to do the IFAS, IgG, which is recommended by Prof. Puchucherry from UM. And we also found out if you do IFAS on those patients who come in with fever, a lot of time you're going to see false positive result, about 28%. So it tells me that the serology is useless. So we should change the diagnostic way or methods to confirm melioidosis. I think PCR is a way to go. IFAS or serology, we should not do at all. And so we actually look at recent year, we find actually melioidosis actually getting better. I think most of the patients are treated well, but unfortunately the mortality is still high. I think there's a lot of room to improve. How else that we can improve the survival of the patients? And I'm not sure whether you know there's this rubella outbreak of melioidosis in 2010. After the outbreak, we were called, actually me, Prof. Jama, we were called to join JKNP.
Can you go with the clip next to Adam's shirt?
To join JKNP to investigate about the outbreak. And subsequently, JKNP wanted to take over this registry. So now the registry is under JKNP. So from there, I actually start to move through lung cancer research. Basically, a few things. I think as a clinician, we need to think. At that time, HDA also got ID physician. They are the one that taking care of melioidosis. So there are less cases ever referred to me. And now also patient is everywhere in Pahang. No, those days, most of the melioidosis patient will end up in HDA as well as Hoshas. But now they can be in any of the district hospital. To capture data is very difficult. So that's why I decided to move melioidosis to away, and then I concentrate my new research area is now lung cancer. And why lung cancer? So we did a study many years ago. We found out actually lung cancer survival is very poor in Malaysia, in Pahang. It's one of the worst actually in the world. And why is it bad? It's because most of the patients are treated by chemotherapy. We look at patients who are treated with chemo, and it's as good as the clinical trial data, about 9 months, which clinical trial data is about 10 months. So it tells us that we are treating the patient okay, but why the overall mortality is so poor is because a lot of our patients cannot afford expensive treatment like immunotherapy. I just give you a case of mine that I saw like about 6 years ago, stage 4 lung cancer, adenocarcinoma. So this patient actually gone to one of the landmark study called Keynote 042 trial and was randomized to pembrolizumab. Later I'll tell you what is pembrolizumab. It's a form of immunotherapy. And then he developed side effect, which is called pneumonitis after 10 months. And despite 10 months of treatment, what happened is he never have any relapse anymore. This is stage 4 lung cancer. It's not stage 1, stage 2. We do surgery, some of the patient will be cured. But this is stage 4 lung cancer. You can see that the tumor never come back, you know. So this is something that surprised me. And so later on, there's a study to show that actually this drug, immunotherapy, actually have good 5-year survival in lung cancer patients, even advanced stage. These are all patients that are given for stage 4 lung cancer. And so I just want to talk a bit about to the young lecturer about benefit of industrial sponsored clinical trial. So Keynote 042 is one of the trial that I was doing. I was involved in clinical trial for more than 10 years. I think it's very good, especially if you are doing a disease like very expensive treatment like rheumatoid arthritis, a lot of biologic involved and all this. Cancer definitely is one. I always tell Dr. Inani to do clinical trial so the patient get free treatment and so that the patient can survive longer. And we also learn about how to do research from clinical trial. And we also learn about the disease better. And then we know about new drug. When I give pembrolizumab, this drug is never tested you know, in Malaysia and also in the world. Also, it was just a phase 1 and phase 2 clinical trial. So we learn a lot from how to use the drug, what are the side effects, how to monitor the side effect, and etc. So when the drug was launched, then we were, you know, labeled as a expert. So we were invited for advisory board, sometimes local, sometimes international. And then, of course, you will be given honorarium for the trial that you are doing. And good thing about also when you do clinical trial, you got money from the pharma company. So you can use some of this money to fund. I even use the money to buy medication for patients. You know, I can buy equipment, oxygen concentrator, etc. You know, of course, your CV also look good. And sometimes you're lucky if you recruit a lot of patients, your name will be there. I'm not sure whether you can spot my name there. And one of the author. And these are some benefit of clinical trial. I strongly encourage you to do clinical trial. Then for the past 10 years, when I was doing a lot of clinical trial, and you can see the lung cancer survival in HTA is much better now. And a lot more patients on immunotherapy, a lot more patients on targeted therapy. But is it good enough? Probably it's not good enough. And you know, this pembrolizumab or immunotherapy, it costs 600,000 ringgit. And it's not available in government hospital. I can tell you, it's never going to get into Blue Book for the next 10 years or so. And some of the hospital who treat lung cancer and never use this drug, or some of the oncologists never use this drug, actually, I would say. And this drug, of course, immunotherapy can treat not only lung cancer, all cancer, hepatoma, it can treat ovarian cancer, breast cancer. So by right, a lot more doctors should use this drug, and we are actively treating all this cancer as well in SASMED. So we should use this drug as well for all these cancer patients. But unfortunately, because the drug is so expensive, so that's why, you know, a lot of patients cannot afford to buy, and then it's not available in the hospital. So a lot of doctors are not using this drug. So now come to research question. Can we give less doses or lower dose? So these are some things that you got to think about. See, this patient of mine only given 10 doses, and it's like basically cure for stage 4 lung cancer. You never get this. I can tell you, when the patient with lung cancer stage 4, usually they survive only for 1 year. That's why the median survival is only 1 year. I show you just now from our HTA data, it's only 9 months they survive. You know, but this patient can survive for 6 years, and then the disease never recur. So he's like cure, right? So I think this drug is, to me, is very interesting. We need to investigate a bit more. But unfortunately, the pharma company, they can't be bothered. They just want the patient to give to buy 3 weekly so that they can make tons of money and can make more money, you know. But actually, you look at these drugs. So now, as a clinician, it's quite difficult for me to understand pharmacokinetic, pharmacodynamic, but I need to go and read all the basic medical science paper. And then you find out actually this immunotherapy, Nivo also is another immunotherapy. It's very important. it's very interesting. When they buy with the receptor, they can buy with the receptor for more than 200 days. You know, so actually this drug probably do not require to give 3 weekly, you know, for 35 doses or etc. So we probably can give a few doses. That may be enough. So come, I do a literature search. I found some case report. Very interesting. This patient given 2 doses only. Patient defaulted follow-up. Come back 3 years later, the doctor said, surprise, hey, how come you're still alive? I thought you're dead already. You know, so when did the scan, he found out, hey, no more tumor seen. So he wrote a case report. This another 2 cases given 3-month or 6-month treatment. And I contacted the author myself, and the author told me the patient is still alive after more than 4 years, even with few doses. And then I saw this abstract about 2 years ago. Another author from US actually presented the paper and also found the same thing. I'm not going to go through detail. I just let you know. There are a lot more evidence. And the other good evidence that is from the neoadjuvant trial. Neoadjuvant means you give chemo, you give immuno, and then after that, you send the patient for surgery. And they found out about up to 38% of the patients, when you look at the tumor cell, all the tumor cells die. So it means that there's a possibility that you give 1 or 2 doses, you know, or 3 doses, the tumor can undergo complete necrosis and the patient may be cured. You see? So 3 years ago, I start to tell the patient, well, you cannot pay for 600,000. Can you pay for 1 dose or 2 doses? And a lot more patients are interested. So I got this patient here, you know, more than 2 years ago. So he come with severe pain, and then his ECOG was 2. And if I give chemo, single agent chemotherapy, response rate is very poor. But he's got a very good characteristic that he may respond to immunotherapy. So I give him 2 doses of immuno. That's all he can afford. And you can see after 2 years, his tumor gone. CA is less than 5. Initial was more than 500. Another patient with psoriasis, giving 3 doses of chemo, doesn't work. So I add 1 dose of immuno, tumor gone, effusion almost gone. And he's very well now. This is more than 2 years. So we published a few case report and case series and got a few more cases. But because a lot of my patients actually go into clinical trial, and every year I can recruit more than 20 patients into immunotherapy trial. So that is the reason why I got very few patients that they purchase medication with 1 or 2 doses. So I plan to do this study. Okay, still looking for grants. I know cannot get FRGS and all these things. Just last Wednesday, I presented the grants applications to Lung Foundation. Hopefully they can sponsor. I also talked to a few businessmen, and some businessmen willing to support this trial, and just to give 2 doses of immuno onto the chemo, which is the standard of care in Malaysia, and see how is the response. And also, actually, we can look at a few other biomarker, and I just show you one of them that I think may be very useful. Is circulating tumor DNA. Means nowadays, you know, you can detect the tumor cell in the blood. Okay, and there's a study to show that those patients who had reduction in ctDNA, they do better, they got better outcome. So I just wonder whether we can give 2 doses of immuno and chemo at the same time, then we monitor their ctDNA. If their ctDNA drop to 0, this patient probably do not require another immunotherapy. Okay, and you know, immunotherapy is not without risk. They can cause inflammation of any organs. I got some patients who are after 1 year treated with immunotherapy, tumor almost all gone, so they get severe colitis and even die of colitis. So the drug is not without risk. You know, whether we give less doses with some biomarker, whether we can actually shorten the duration of the treatment, also it can be cost effective, and also it help in pharmacoeconomics. So I think these are the things that we can study. And if any of you interested in some biomarker tests or for cancer, let me know. And as I say, it's not easy if you want to do the study. I actually presented this many times to pharma company, but all the pharma company refuse to fund this. I presume they refuse because they don't want, you know, the patient, they can sell 35 doses for 1 patient and end out only 2 doses. I presume lah, okay? Because I asked them what's the reason they don't want to fund this sort of study. They just say that, oh, it's not their priority to do this sort of study. That's the things. And I finally managed to meet Prof. Go from NUS, who actually have about the similar thinking that I have is to how to help the poor patient from the developing country, and we probably will work together for this sort of study. And at the same time, also I set out a lung cancer registry in Malaysia. So far, we have 16 centers involved. I also do some collaboration with a few other countries. So what we can do is share experience, and then I actually tell them, even we talk about targeted therapy, low dose actually works as well as the recommended dose. And of course, we need clinical trial to prove that. I was planning a clinical trial many years ago, but again, I can't get the funding from the pharma company. But instead, I asked the pharma company to fund the registry. And when they fund the registry, we get data. So we can show that, oh, like this drug is targeted therapy, whether you give recommended dose or less than recommended dose. My patient used to take half a tablet daily because it costs 4,000 ringgit a month if you take one tablet a day. So a lot of my patients take half a tablet daily or half a tablet EOD, but it's still doing very well. And other drugs, it costs about 14,000 a month. So a lot of my patients just take half a tablets, daily or EOD. Again, based on my literature and based on my data, it's as good as the clinical trial data. So to me, I feel this is something that we can do as a clinician to help poor patients. I know that it's not, I'm not sure whether Malaysia is not out to standard to invent new drugs or whatever. At this moment in time, I don't think there are many Malaysian researchers come out with new drugs. And I'm sure this one, you need a lot of fundings, but at least these are something that I think we can do for our poor patients. Okay, so my final recommendation, disease registry, simple. I think you can come out with what data that you want to capture. Maybe you can work with IT in SASMED. So incorporate your registry form into the clinical practice. So every patient come in, you just tick, male, female, what's the size, smoke, like me, lung cancer, we want to know how many times the patient smoke, etc. And these are the things that you can capture so that you will not waste time. You see patient, at the same time you capture data. Okay, so it's your own registry, and try to get other center involved, other university involved. Let's say you want to do on rheumatoid arthritis, you can get UKM, or even KKM hospital to be involved. So everybody capture the data. So I think it's good to analyze all this data. Of course, you get a bit epidemiology data, which I'm not so interested. I'm more interested to see that whether we can treat the patient with some modified way and still get a reasonable good outcome. I think teamwork and hard work are important. And the other thing, I think you can focus on one or two disease, so that will make you an expert in that particular research area. Okay, thank you very much. I have to go very fast because I only given 15 minutes.
Thank you very much, Prof. Hao. Very informative. I can see how passionate, and you are showing to us that from one idea of your interest, you expand it to many and multiples. And on top of that, there are a lot of effort. What close to me is that you did it without grant. And I guess this very, it's very good that all of us can learn and get guidance from you. So we will give you Q&A questions after the end of the session. So after we learn how to do the research passionately, now we are moving to how to do the research effectively. Now I would like to call Prof. Zamzila to deliver his talk.
Thank you, Dr. Shahida. And Dr. Azwan. Can you hear me?
Yes, we can hear clearly.
Okay, so Prof. Jamal, respected panel, Prof. Hao, Prof. Basri, Prof. Leila, and my beloved colleagues and juniors, Assalamualaikum warahmatullahi wabarakatuh, and good afternoon. Before I go on, I would like to congratulate all the new lecturers and specialists for passing their exam recently and passing their PhD. Okay, I would like to welcome you all to the world of academics. I'm sure some of you may have already started to plan on your career path. Some may want to go for subspecialty, some may want to do PhD, some want to go for postdoc, and some may want to just stay here, fulfill the KPI, and get promoted. So I would like to start with recalling our recent KPI that we have kept up recently. Right. So if you look at our KPI, we have 8 elements in there, where we have teaching supervision, research, publication, community engagement, innovation, networking, service and consultancy, and also awards and recognition. So those are the 8 elements that we have in our KPI. So from these 8 elements, you can notice that most of our KPI are actually related to research. Okay, so if you look at the supervision, research, publication, innovation, pattern, networking, so they are all related to research. So whether we like it or not, as an academician, research is our main KPI actually. So my topic is about how to do research effectively. So ideally, if you look from this KPI, if you want to do research effectively, we have to do something. We have to do a project that can fulfill all our KPI requirements at the same time. So by doing this, we can actually kill many birds with only one stone. Okay, for example, if you are a clinician, you see patients every day, and then from the cases that you see, this will give you some ideas on what research to proceed with. So from that research idea, you can apply research grant. So you get credit for having that research grant. And then from the research grant, you get postgraduate students. So you get another credits for supervision. And then from there, you can publish your work with the postgraduate students. So you get publication points from there. And then since you already have your niche area in your research, you can also go to the community, do some community projects, and then you get points for your community engagement. And after that, you can create some innovation and get the things patented, and you get another credits for that. And from there also, you can build network with the other organization, and you get another points for networking. And finally, when you are focused in your work, people know you for the work that you have done, you can easily get award and recognition. So with this, actually, you can fulfill all your KPIs with just one focus area of research. So this is actually something ideal, and maybe not for everybody. Maybe just some extraordinary person can do it. Okay, but honestly, I am not this extraordinary person. I'm just an ordinary person. So I don't have this kind of project. So when I started my career in academics, I am just like all of you. I have my main limitation is time. Okay, so time, how to find time to do research? Because most of our time actually we focus on the academic works. We focus on the preparation of lectures, exam, and so on, all related to academic. And we also, so when we come in, we are given some responsibilities as coordinator here and there. So most of our time actually spent for this academic works. And for this clinician, maybe they spend most of the time to do the service. So where do they find time to do research? So this is a question for everybody actually at every level. Okay, so to me, to answer the question of how to get time to do research is number one, and the most important thing is to have the intention to do the research, because I believe that research do not come accidentally. So you have to plan. You must have intention first to do research, then only you will have a plan. So from intention, this will be followed by planning of the research activity. So you plan how to get research idea, how to do the proposal, what grant to be applied. So this has to be in your plan. Okay, so with your intention, you have your plan. So because when you have a planned activity, your research will become smooth, that will also save your time. So from there, from your research activity that you have planned, you have to allocate some time, okay, in your daily and weekly activity. And most people will say that I have work full, okay, from Monday to Friday, from 8 to 5, I have full of activities. So actually, you can find time in your daily and weekly routine, whether you can take early morning, for instance, from 8 to 9, to focus on your research activity, to prepare proposal and whatnot, or you can do it in the evening before you go back. Okay, from 4 to 5, spend some time for you to plan and to conduct the research activities. And some people, they can allocate like one day, research day, in their daily plan, in their weekly planning. So they have like Friday is the research day. So on Friday, they just focus on the research activity, whether to do brainstorming, to write proposal, to apply for grant, and so on. They have some dedicated day and some dedicated time to plan for the research activity. And another thing that I found important in research is that set a deadline. So if let's say you want to prepare a research proposal for FRGS, know when is the deadline for the submission, then you set your own deadline to submit your proposal. So by having the deadline, it is important as a pushing factor to you to work on your research. So those are the important points about the how to plan, how to get time to do research. So next is to do research effectively, you must have good ideas. So how to get idea for research, Dr. Leila has mentioned just now. And then once you get idea for research, you have to create and maintain your interest. So as Prof. Hao mentioned just now, he did a lot of things to maintain his interest. Okay, but what I can add from that is that in order for you to create interest, firstly you can look around you. So look at the facilities. What are the facilities that is available around you? For instance, in BNS, you have like those who are expert with proteomics, with molecular. So you can think of some of research related to that. Like in the pathology department, we can provide a various kind of diagnostic tests. So you may also think of the research that can include those available facilities. Okay, and next, to get financial support. Of course, some would say that we can do research even without any financial aid, even without grant. Yes, we can do. But in order to do effective research, you need to have grant, because by having grant, we can buy research materials so that the research that we do is more. We can do research that is that covers a deeper area, because we have some money allocation to do that. So from there also, from research grant also, we can get GRA, graduate research assistant, because this is important. The graduate research assistant basically is our postgraduate student. So by having the postgraduate student, they will help us a lot in carrying out the research activity as well as in publication. Okay, and from grant also, we can get money for publication. Okay, we know that some of the publication we need to pay, and that will require a lot of money, so we can use the grant money, and also we can use that grant money for the maintenance of equipment. Okay, and next will come which grant to apply. Okay, so if you notice that nowadays RMC have given so many announcements about the availability of new grants here and there. So to me, as a new staff, academic staff, maybe if you want to start, we can start with a small grant that is easily approved. Then you go for it first. Get the feeling of doing a research by having a small grant first. Then only after you succeed with your first grant, that will become the motivation for you to go for a higher or bigger grant. So that is about the financial support. So again, about the grant application. So when you want to apply for grants, make sure that your team members are actually a good team. So what carries a good team? To me, a good team will comprise of those with similar interests with you. So similar interest doesn't mean that those who have got the same opinion with you at all times. You may have somebody in your team with someone who may not always be in the same opinion with you, but they can complement you. So you may be lacking in this area, but they have that ability. So in this way we can always complement each other. You know, for example, me and Dr. Leila, we have many research that we did together, but actually in many occasions our opinion is not always the same. We usually have many times we have always opposite opinion. So, but that opposite opinion actually is good in research because I look at different perspective. She look at different perspective. So with different perspective, we come to an agreement. By considering her perspective and also my perspective. So that will make our research become better because we see things from many perspectives. So that's, I think, one of the important factor in determining the team members. So get a team members that can complement you. So another thing about the team members is that try to get a team members from various disciplines. So like you are surgeon, you get team members from the you get radiologists as your team members, you get the lab people or bio BMS people to support your lab diagnosis, and also from the other statistician can also be part of your team members. So by having the members from various teams, this will help you to produce a better research. Okay, and then about the team members again, make sure that in your team you have both seniors and juniors. So juniors will learn from senior will give you an overview about your research, whether your research is feasible or not, whether there is possibility of problem in your research. That usually senior people will be able to tell you. Okay, and not to forget, when you have many team members in a research, make sure that you define the role of each member in your group, because by giving them certain role, this will make them feeling good, because I know that I am in this research group and I know what is my role, so I feel good about it, rather than just be a sleeping partner in that research group. So that's about the team members. And next, when you get the grant, make sure that you manage the grant properly. So how to manage grant properly? First, you have to make sure that you follow the milestone that you put in your proposal. Next is make sure that you keep a record book of all the research activities. Usually what I did, I told my student to keep one record book for all the research activities, where you write everything about the research activity, the sample collection, the results and everything in that record book. But nowadays you can do it digitally lah. Okay, and also make sure that when you get grant, make sure that when they request for the report, make sure you submit the report on time. And this is important for our reputation, because if you do not submit report on time, you may be barred from applying another grant, or even you cannot be the co-researcher for the next grant. So make sure that you submit the report on time. Right, and then make sure that in your application you include GRA education, because PG, as I mentioned earlier, PG student is very important because they can help us to carry out the research. They can also give us point for supervision, and they can also help us for the publication. Then with regards to the research output, so when you in the beginning of your proposal, research proposal, make sure you set a realistic target. Okay, do not put like I would like to produce 10 papers from this grant, because you may not be able to get that 10. So you may be penalized because you don't reach the target. So to me, you better start with not too ambitious. You may put like three publications from your research, from your grant. Then if you get more, that will be better. So that's about the research output. And finally, for the research to be effective, make sure that your research is visible to others. So you have to you have to be in the Google Scholar, Academia, ResearchGate, or anything lah. I think the younger people know this better lah, to make your research visible to others. And last but not least, after you did everything, okay, don't forget to apply for your promotion, because after all, this is one of the reasons why we do research. So with that, I thank you.
All right, thank you, Prof. Zam, for the very enriching information that you have given us. You have given us so many things. Can't wait to ask you many questions as well later. But it's interesting that you mentioned that in your team that there is a senior and junior combination in that team. And this is relevant for the next speaker, which is from Prof. Datuk Basri on how to do research mentoring.
Thank you, Dr. Azfanis. I think I need to wait until the announcement stopped. It's quite a long announcement. Okay. Thank you, Madam Chairman, Chairperson. Okay. I think that there must be a reason why they put me as the last speaker, and so I'm going to share. We are given about 15 to 20 minutes to talk a bit on the topics. Sorry. So I prepare a few slides. So the topic that given to me is on how to do research mentoring. The main objective of my topic on top of covering what given to me. So one of the topics maybe I can inspire some of you in doing research. Okay, first of all, I think for clinicians, we like to ask whether mentoring in academic medicine is evidence-based. There is one paper published in the 2006. It's a systematic review on mentoring in academic medicine. So from this systematic review, they found that there are not many papers out of 3,640. After all the exclusion criteria, only about 42 articles included, and most of them are cross-sectional study. Okay, so what's the main findings? The main findings was in some of the fields or area in medicine, about 20% of the staff or faculty members had a mentor. So, and the other one is women perceive that they had more difficulty in finding mentors than their colleagues who are men. Mentorship has reported to have important influence on personal development, all right, the career guidance and choice, research productivity, including publication and grant success. Another thing is, how about developing a culture, research culture and mentorship culture? This paper mentioned that the mentorship require a strong commitment from all by the leaders at all levels. So we have few departments, so which each department must have good mentors. And this culture of mentorship should encompass a variety of activities like advising, teaching, coaching, advocacy, sponsorship, role modeling, and as well as personal development and achieving work-life balance. So I think this some paragraph summarize some of the important or dynamic aspects of mentorship. Okay, so before I continue, I will actually, I'm not the right person to, I was, no, when the topic was given to me, I also thought that, is it the right, am I the right person to talk about this? Okay, maybe at the end of the session, I can answer that. Do we need research mentoring at COM? I feel yes. That's what I've told the dean. But how? We had to think about the mechanism. There are many ways of doing the mentoring. And actually, the virtual mentoring is feasible. Yeah, I got a few experience in doing so. And do we need training of mentoring? That one I'm not sure, but from my experience, when I was at the HTA, I mean, when before the suspect was built, I attended the mentoring workshop that organized by the CRM, but not by the current CEO. Was organized by the previous CEO, so about long time ago. Even though that I think that I'm not the right person to talk about this, I think that I can share some experience and from what I've learned from the past 22 years as academic staff here, and some of the mistakes I have done. I can, give some tips about mentoring. If you attended the MRS workshop recently, there's one lecture on the mentoring. So just a recap, what is mentoring? Is a reciprocal and collaborative at-will relationship. So it's a mutual and volunteer, and both agree as a mentor and a mentee. Most of the mentor and mentee relationship is a long-term relationship. Is a long-term relationship that focusing on support, like mentioned earlier, supporting the growth and the development of the mentee. Okay, and what are the processes? They're all interconnected. So we have to clear about the purpose of the mentoring, understanding how to achieve the goals, and some skills for both mentor and mentee. Communication is very important. This is for reviewing as well, and the ongoing commitment that the process. Okay, when I talk to the junior staff in the department and also us around, they always say that, are you lost? When we finish, especially the clinicians, we finish the MED or you got the professional qualifications, after that join the faculty, join kuliah. So like me last time, I was from HKL, seconded to IUM. So I was a specialist at Hospital Kuala Lumpur. So I don't have any experience become academicians. So I just like practice same as I was before as a clinicians. So we got undergraduate, but later on progress into postgraduates, supervising postgraduates, preparing exam questions, so on and so forth. Okay, that most of the time occupied by all this. Yeah? However, on the other side, that have been highlighted, but especially by the previous speakers, that there are many other things that we need to do. Yeah? So in terms of the mentor and mentoring, I'm not sure about the focus of this talk. The focus of this lecture maybe depends on the context, whether to help you to survive as academician here, or how to mentor your supervise your students, PG or undergraduate. It's all depend. But I think that the most important for this forum, as highlighted by the dean, is to guide you along the way from here from your day one until you become a full professor one day. So hopefully after 5 years as academician, you enjoy, you develop your passions, you not the planning to like leaving the university. What Prof. Amarita, Prof. Asma said, that we are here because lillahi ta'ala. That's the main one. It's not because of money or etc. So, and she said that if you want money, this is not the place. So that is our niat lah, first of all. But anyway, as mentioned by Prof. Zamzila earlier, that grant, the applying of the grant is very important. So you have to focus to be the principal investigator. What are the baby steps? The baby step is to get the internal grant. The internal grant meaning that it's less competitive compared to external grant because the money already allocated and the RMC or the funder really want to like execute, want to give the money. So the purpose of the internal grant is to make you, like Prof. Zam said, that to feel, doing the research, to feel how to manage the grant so that you will be able to manage a bigger grant later, right? And the thing is that for internal grant, it's a small grant which you can finish in the 1 or 2 years, not like FRGS or PRJ or other external grant. So what I've learned last time, and I was the head of research, right? So the majority of the researchers, they really need guidance in terms of writing the report, how to write. I mean, do the progress report in terms of milestone activities, etc. And the funding management of the money, the financial is quite important as well. So when I was the head of research for 3 or 4 years, I can't remember what, 3 years, we actually, the RMC quite kind for internal research. We just want you to like complete it. And at one stage, I don't think that the purpose of conducting the research achieve, because sometimes to have the lecturer, we just approve as long as you reach it, but not touch at all. 20K given and 20K return. So by right, the purpose of the internal grant is to for you to feel you're able to manage it. But later, you can go and be more competitive, like for FRGS, PRGS, mostly grant. So when you able to secure external grant, so meaning that you are more competitive. So the external grant, including not just national, like mentioned earlier by the MOHI or MOSTI, also industrial grants, international, and also industrial sponsored research. Then we talk about the KTPs or knowledge transfer projects. Okay, so Prof. Zam mentioned about the research progress managing the grant, research visibility. So we need to be visible, and the toughest one is maybe the IRAP. If let's say that you don't have time to update your give a talk given in conferences, etc., but you can at least you repository the articles. Okay, so you need other things, the update your Scopus, your ORCID, the ResearchGate and Google Scholar, so that you become more visible. Okay. Then the publications. So the publication is your investment in terms of the how influential you are in your area. So the higher that you get the citation, That's your H index. So by right that the full professor, I mean for clinical, I know that for the clinical maybe it's easier. For professor, we should aim for the higher index so that reflect how influential you are in your field. Networking and collaboration in terms of national, within inter-universities, international, involve the societies, universities, and the research institutions. We can discuss that in the Q&A later on. MOA, the Memorandum of Agreement for in local or international, and MOUs or local or international research collaborations. Then not only that, I think that the progress of the academician, like me, example, like have been in the university for the past 20 years, I should have like now go for it. For me, I have secured most of the grant, but I'm focusing on the prototypes, patent, and commercialization. So I was told that by right, before professor retire, they should have prototype or patents. So even though that I would try, if not successful, it's okay. At least I tried. Okay, so the mentoring, the most of the topic covered by the previous lecturers, right? So the mentor need to have the experience and the skills of some of the questions highlighted earlier. So to mentor, we have to identify the goal. Provide the training, the support, motivation, advice, coaching. So the coaching and direction, and by the end of it, success. So that's the aim. So the process from point A, where you are now, to point B, where what you want to achieve, right? So that process, this is the process. So the mentor should help you to move from point A to point B with all this, like support, coaching, advice, motivation, training, etc. So how to structure the mentoring session? So this is the principle. What are the types of mentoring? So it can be one-to-one, distance of e-mentoring. So I had the experience of e-mentoring because now I'm involved in the because I'm able to secure international grant by Wellcome Trust Oxford, UK, with the Oxford team. One of the applicants from Malaysia. So I'm able to secure this grant until 2025. So most of the meeting and mentoring done by Zoom. So we had weekly and now a fortnightly meeting, and group mentoring. So the three types of the mentoring. So the phases, the preparation, negotiating, enabling growth and closure is from the previous talk, the MRS, and the explanation of the strategies and step of each. So what is preparation, negotiating, enabling growth and closure? So all interconnected. Okay. What are the method that you can use? You can use GROW method. The GROW method has been used a lot in coaching, where G is goal, R is reality, O is obstacles and option, and W is way forward. Okay, so when you set the goal, so your goal is your point B. So you need to start with a goal with the end of mind. So if you listen to a lot of motivational talk, they said that you have to train your subconscious mind with the end in your there already, in your mind already. So the goal has to be smart, like Prof. said, has to be the specific. Like you know specific, right? So if you want to lose weight, not just by losing weight, I want to lose 10 kilo in maybe 6 months, etc. Something like that. So the goal has to be smart as for specific, measurable, achievable, and realistic and time bound. So you give the timeline. So reality. So now you need to think about where are you now, and what what you want to achieve. So you know what is the gap between the reality and your objective. So then you need to monitor what is the progress so far. So options. So you need to brainstorm how to achieve the goal. Then so if you tackle any problem, you think about how have you tackled a similar situation before and how to solve it. Okay, the way forward is how you do it. So a lot of commitment, meetings, consistent meeting and actions to achieve the goal. Another way, another method is called OSCAR, but a lot of people are using OSCAR method. And O is outcomes, same as goals. Is your, what you want to achieve, or we call it future reality. The situation, what are you now? What is your perception and reality? So what the gap, choices and consequences. So what is your current situation? So you ask yourself what is actually happening, etc. And what the choices you have, what the consequences for each choice that you make, the action, what action will you take, when will you take all these actions, and on the scale of 0 to 10, how likely you are, likely you can achieve, you can take the actions now, and review the process. You need to reflect and review about the progress, and ask the mentor and how he can help. So the relationship between the mentor and mentee, so based on trust, confidentiality, mutual respect, and the sensitivity for whatever that situation arises during the process. Okay, the relationship. So what we call it, what about if it doesn't work, that it doesn't click, so there is a chemistry problem. So for the mentorship to be successful, must be mutual, there will be a reciprocity, mutual respect, a sense of similar expectations, personal connection, and shared values. And unsuccessful relationship, if there is poor communication and poor or lack of commitment, personality differences, perceived or real competition, conflict of interest, and mentors' lack of experience and training. Okay, so lastly, I always ask my lecturers. So, do you know? Do you practice any time management? Do you know any time management concept, etc.? So most of them not sure. At least if you know Stephen Covey, so I always tell them that at least you know this part, so that it can guide you how you manage your time. So you do this Stephen Covey time management matrix. So you make into like urgent, no urgent, important, and not important, meaning that what is important, your life, and whether it is want to do now or achieve later, and not important. So the quadrant, the most of the time for us as clinician, we are here. So most of the time we are like on the move, the urgent and important, right? So a lot of deadline, etc. So if we spend a lot of time here, so that's how burnout happen. But our KPI, what we want to achieve, not just KPI lah, our balance life, right, is here. So it's important but not urgent. So for urgent and not important, sometimes a lot of people confuse between the 1 and 3. 1 and 3, yeah, because this activity can be deceptive. Example, like some of the phone calls and emails may be not really important. You spend so much time on the things that you know, that urgent and not important. So okay, and these 4, then when you burn out, they say that you spend more time, then lepas tu you pergi ke 4, because like you know, spend more time on the social media or etc. Yeah? But however, sometimes that what they said that you can push 4 to 2, the 4 to 2. This is only the concept that I learned a bit. In terms of like you know, what bring happiness, because happiness is one of the important thing that you need to achieve. Okay, so before I end, first thing first, what matters most and what matters most. So this is the thing that you need to, you know, principle that you need to grip, spend more time in quadrant 2. One of the book I recommend that I've read cover to cover is How Getting the Right Work Done is by Harvard Business Review. It's good. All the chapters written by a CEO of various company, and it combines a lot of principles, like you know, the like 9 things successful people do. Stephen Covey, first thing first, etc. And they said that here the management of time is like management of energy. Yeah? So with that, thank you. Pass back to the moderator.
Thank you, Prof. Basri. I can understand that how is the effective mentorship? It involves teaching, coaching, supervision, advocacy, all the terms. Nicely how effective a long-term relationship between the mentor and mentee. And Prof. Basri, I have questioned that in reality, how you supervise your mentee, and what is the expected contribution by both mentor and mentee in terms of the research output?
Okay. Oh, you okay? Now Q&A, Dr. Shahidah. Thank you. All right. So can you repeat the question again? Because I want to understand in which context.
Yeah.
How big is the scope?
It means that in reality, Prof. Basri has been mentor a lot of mentee, I guess, with a lot of publication. So can you explain to us, because we are still new and we have also our master student, how you supervise your mentee in reality, in practical, and then in terms of contribution to produce the research output, the outcome, what is the expected contribution between the mentor and mentee?
Okay, you talk about between the scenario is between me and my PG or my lecturer?
Between your PG student.
Oh, PG, postgraduate. So
depends. Dia kata macam petang, tapi dia tanya dia. Saya bertanya pagi macam mana, boleh tak?
So kalau dia boleh ni pagi.
All right. Thank you for the question. So the scope is between the we and the PG student. That's very good question. Whereby that the number one is the availability lah. So and that's the most important. Like me, if you know that most of the time I'm here. If I don't have anything, so I'll be in my room. So they just knock my room, and I'm available for any consult. And immediate feedback. So have to be ready to give immediate feedback. So along the way, you need to. I always like stress on the time management. Even though I have many ways of like you know, that theory about that, and the concept of like 9 things that you should do. Got 3 like where you are now and how you monitor and reflect, and what the goal, what the outcome. to be done. So a lot of time, it's not easy, the obstacles. So I always got the plan A, B, and C. Example, recently, the blood. So I need to send the blood specimen to Australia, but I explore locally. I ask UM, can they analyze, do the the HPLC on the tazocine. So UM cost 1,000 per test, per blood test. I got 50 kali 4, about 200 samples to analyze. Okay, so but anyway, then I contact the courier. The courier that I used before is no longer active. So what I do is, luckily I got my connections in UQ, whereby they say it's okay. There is one researcher now in sending their blood. I can tumpang the blood. So as the mentor, I need to find solve the problem, not to leave. Because when I ask my student, she is Afghan student from the student, so she just asked, so what we should do next? Oh, professor, you need to send the blood. So but she cannot help. So but I have to find a solution for her. So finally, it's all done with some limited budget. So I'm really happy with what Prof. Zam mentioned earlier. To do research, you need to get grant. You need funding. That's the most important. To do good research, you need to get funding. So thank you, Dr. Seda. So that's how I answer.
Prof. Basri, I have another question, a bit sensitive, because I was I was interested with the first JAMA abstract that telling there are different between female and male in terms of the difficulty of getting their mentor. So how is your experience in terms of having all your mentee? Are the different between two genders?
Okay, right. So I
or any
for
obstacle?
me, because of my time, so I'm wearing many hats because I got a lot of position in terms of the national and internationally, so etc. So my method of the mentoring is like I prefer one-to-one, and I choose. So not many for lecturer. I think that up to about the 2 or 3 only. Yeah. And so far, actually, I out of 1, 2, 3. So it's okay. I don't feel that any. I'm not sure about the other experience, other lecturers. So one of my mentee is a female lecturer. So whereby I also include her in my international research. So, and every 2 weeks, we are being coached by a female mentor from Oxford. So, that. So we are okay. We are okay. So one more thing is like coach, like coaching in life. We need coach. So if you want to excel, even the best tennis player in the world, the best squash player in the world, best badminton, they still need a coach. So like me, I still got even though that the person in the UK call me prof, but I still learn a lot from her. I think I knew that in the process she was coaching me and helping me to coach another mentee. It's my academic lecturer. So tetapi kan what my point here from my lecture is, for the lecturer, you have to do a baby step, meaning that you need to get the feel of doing research by internal grant. Bila you dah pandai, you go for the external grant, like apply for. When I was the president of the MSIC, so we created the grant by the society. So I asked my lecturer to apply. And now we have created the Malaysian MSIC Critical Tie Group. That is my platform for me to do later on to spread and mentoring some of the doctors in the government who are interested to do research in critical care. So, I also in terms of the Asia Pacific. So I'm active in the Asia Critical Care Group. clinical trial where we also do a lot of things like training in Asia, around Asia, because we have very strong. Then now I'm also representing Asia for in the World Federation of Society of so we now where I meet more people. So when we involve like I mean the key is to have to active in a society. Yeah? When we active in society, then we got the recognition. When we got the recognition, that we get more exposure exposure which may help us in process or the mentoring lah. Okay? Jadi the baby step is like memula you buat internal grant, try external grant. Like me, I applied the 2 or 3 to I got one FIGS. I'm mentoring one the person to get the FIGS dapat. Then the 2 fail. But anyway, we are preparing more, can apply. But I think now I'm focusing on the prototype or patents lah. Yeah? So, like Prof. Hafiz lah. So he got prototype and commercialization. So like
Thank you, Prof. I think it will be very pleasure to have another session with you, how to get all the grants, the skills that we can learn from you. Okay, so I pass to Dr. Azwani for.
Thank you, Prof. Thank you, Dr. Shahida. So actually, we have a lot of questions here for each of our speakers. So the first question goes to Prof. Leila. Okay. Prof. Leila, the question is, ideas has come and we have many ideas, but how do we know which idea is actually practicable to do?
Right. Okay. I think Dr. Zam actually covered this as well. Sometimes you have ideas, but it's not practical because you don't have the facilities to basically execute the ideas. And number 2, sometimes you have ideas, but you don't have the expertise to basically run part of the ideas, right? So sometimes I would rather say when I started doing research in my early days of being the academician, I think long time ago, we just do something quite simple first, as what Prof. Basri mentioned just now. Perhaps just ask for simple grant, internal grant, or even you can do something which is non-need grant. I think this is very. I think the clinical side. I think that's. I think it can be. Things that you can do actually, but for those in basic sciences, most of the time you need grant. That's the things, because you running things, you need to do some animal model, experimenting things. You need grant. And even internal grant is not, I think it's just 20K, perhaps not enough. But I think after, if I recall back my experience, if you write well, you can still get external grant, because that's based on my personal experience. You write well, you have the what I call the research gap, which is of interest to the reviewers, and then is a novel and it's fundamental. You can still get grant, and then you can execute your ideas. So idea comes first, but practicality comes later. But I think it can be just choose ideas that which is practical. I think that's the gist of the my answer.
I understand.
I hope I answered the question.
You did. So you're saying that we should start small, and the most important thing is try apply for smaller grants first. I think that's what Prof. Basri was saying. But the thing is,
but no harm asking for bigger grant. If you write well, you can get. Because experience, based on our experience with the Zamira, we start with nothing, but we managed to get. So I think that's also, the newer academic staff, for example, or Dr. Roslina,
I think the problem is,
I think they will grant you.
I think rejection is the problem that I think why younger lecturers are afraid of applying for grants, because afraid of rejection. And I think Prof. Howe just now had some experience. He was mentioning about rejection from pharma companies. I mean, even a well-established professor also gets rejection. So there's rejection will be faced at all levels, I suppose, in research.
Yeah.
But now I'd just like to ask Prof. Howe. Prof. Howe, since you mentioned about that particular experience, rejection from pharma companies, how do you handle rejections? What do you do after that? Can you please share with us?
Sure, thanks. Can you hear me, right?
Yes, yes, we can.
Actually, when I submit the grants to the pharma company, I was actually 99.99% sure that they are going to reject me. But I still try. I think a few years ago, I submitted another grants applications. Actually, not really grant application. I submit to pharma company. I just want the drugs because we have formed a group in Malaysia about lung cancer research. And most of us are happy to do the trial without being paid at all and without any help from research grants. So that we are just wanted to collect the data to show that earlier on I was putting out a proposal of low dose osimertinib, 40 milligram EOD compared to the conventional dose. But because the drug is very expensive, as I mentioned, the drug costs about 14,000 a month. So there's no way that we can get government funded research. And we also even try to find some research elsewhere, but the amount is too high. So you need millions of dollars just to buy drugs. So basically, we are just asking drugs company to give us a free drugs. Then we will do the trial. But unfortunately, as I mentioned earlier on, the pharma company, they don't really, actually the Malaysia pharma, I have a few meetings with the Malaysia pharma company. I managed to convince them this trial is good for patients. And I even tell them that because there's not to say there's no ground at all. So based on the previous research case report and etc., even their phase 1 study, like even low dose of osimertinib, actually they did their phase 1 study. They found 20 milligram is as good as 80 milligram. But then when we go to phase 3, they are using 80 milligram. So, but our patient cannot afford 80 milligram. So one of the way is to give them like 40 milligram EOD, ask them to break the tablets. So my special interest is to see whether when you break the tablet and you take lower dose, whether it's as good as you take normal dose. So I can tell you many years ago, I actually proposing this drug called afatinib, which I show you the slide as well. And when I first presented to our colleague, a lot of them say, no, not enough data. I'm not going to ask the patient to break the tablets, this and that. So I show them a small data from myself, just about 20 patients, and some of them follow. So now, after a few years, I see from the registry, at least a few handful of center, start using half a tablet daily for the patients. And that's how we can pull all this data. And even the pharma company don't want to sponsor, we can have real world data to prove that half a tablet daily or EOD works. Okay, so now I'm actually promoting half a tablet for this osimertinib as well. The reason why I so interested in this half a dose, in fact, I was thinking that I got a few patients who cannot afford all this expensive treatment. They don't take every day. They just take once every few days, And it's very interesting. You find this patient, they never progress. They take a long time before they fail the medication because, these are targeted therapy. Just now I show you is immunotherapy. Targeted therapy actually it target on a certain molecule. And this is very interesting. So now I'm working with UPM to do some molecular study as well as animal study to see actually, is it correct we should use the drug daily rather than we should use, I call it pulse therapy. You should take the drug every 3-4 days rather than take it every day. And the reason for it, there is some molecular background. Actually, you see, I'm a clinician. I know nothing about cancer biology. Until when I found patient like this, I actually go back and find all these basic medical science data. I actually found that actually some scientists had proposed this. Actually, even in my mind at that time, I just wonder, why the tumor-derived resistance. One of the mechanism is actually now we know that the tumor in terms of molecular is very, very heterogeneous. When a patient with a cancer cell, which is lung cancer, adenocarcinoma, not all the cells are the same. They are not all having, say, one of the mutation, common one is called 19 deletion. Not all of them have this. Some of them have probably mutation as chromosome 20, but the amount is very small. So that's why it cannot be detected if you do the conventional PCR. So what happens is if you take a drug which can kill the 19 deletion, then the resistant clone will overgrow. So if you take the drug once every few days, so it may be good actually to delay progression. So that was my thinking. But I found out actually a lot of scientists also propose this, but of course the pharma company will not take this and do clinical trial. You get what I mean? I'm sure you know why they don't want, right? So that's why we are doing some animal study and see what is the optimal way of housing the patients. And it's just like the drug itraconazole in fungal infection. Previously, we used to use daily, and then later on, they found out actually weekly dose is better than daily dose, less side effect and more cost effective, and efficacy is the same. So that's why these are something that I think we can do, like innovative way of treating our poor patients.
All right, thank you, Prof. I can see the passion coming from you when you're talking about your research area. I think the next question we have is relevant to this. Dr. Shahida will be asking you.
Yes. Prof, how I can see you have, is it okay? Prof, how I can see that you have enormous publication, but would you mind sharing to us how you delegate your works into members so that you can accomplish a good job in papers? Do you have like special research assistant? This is a strategy that we need to learn from you, because we can't work alone. So is there anything that you can add on?
Well, of course, I think first, even I told you that I did a few trial, actually, a few research or collecting data and all these things. I don't really get research grants, but so what I do is I get people who are interested. My first initial few study, when we collect data, I even get some of the MO at that time. And now, of course, they are specialists already to help me to collect the data. I told them I got no money to give you, I'll give you authorship. Of course, I will actually discuss with them and talk to them about the disease and then see whether they got any opinion. They may got a good opinion. So then when we write the manuscript, we actually use their opinions as well. So that is one way. And then, of course, I think, you want to be a good researcher and at the same time a good clinician, it's going to be very difficult, okay, unless you really sacrifice. So the best people to sacrifice, of course, is your family lah. I'm not sure whether you will agree with me, but I know I'm getting old now. I get my kids are all very big, and now I realize that they are not very attached to me. They're all attached to their mothers. So I think that is something that you had to sacrifice. I still remember in those days, we are in the hospital 8 to 9, 8 to 5, 6 or 7 sometime. Especially when I first came to HTA, there were only 5 physicians that we had to run the whole ward. So I think end of the day, really, you had to sacrifice. So usually I collect data during working hours, and then you only can analyze at night or over the weekend. But now, of course, it's getting better because UIA is getting bigger. I'm sure, Shaida, you also helped me to publish one paper. So now we got a lot of people young people especially, keen to write and publish. So I can collect the data and give it to them. And I even collect the data and give it to one of the lecturer in UM and say, you write the whole paper, I even tell them about my idea. And then I say, you can, of course, chip in your idea. That is from our lung cancer registry. I just not encourage everyone to do clinical trial is because you can get quite a lot of money from clinical trial. And I actually have a personal research assistant for many, many years. I used to employ our own students, graduate students. I always offered, who from Kuantan, who want to join me? I pay you 1,500 per month, because they got to wait for housemanship for 1 year anyway. So they are the one that helping me to do research. I think, Shahida, remember or not? I think, is it Amma at that time, or I think Afifa or something like this, helping you to collect data. Your time, I can't remember, because every year they change. Yeah, Ama. So now I still got one research assistant who helped me. In fact, my last research assistant was very good. Is a medical student, graduate from Newcastle, and someone recommend to me, and then she actually helped me to publish paper also, you know. I'm not sure I answered your question.
Yes, you answer very well, Prof. Okay, next we move to another question to Prof. Zam.
Okay, Prof. Zamzila, there's a question for you. You mentioned teamwork just now, that we need to find people of similar interests. But sometimes what happens is that we don't have the same interest as the other teams. We also have other interests as well. So how do we find them, these people with similar interests, just and passionate just like us in that particular topic?
Thank you, Dr. Azwanis. So your question is about how to get people with the same interest to do research with you.
Yes.
All right. Yeah. Yeah. First thing is that you have to get other people to know what is your interest. So when you have some research idea, get the other people know of what is your interest. Because if people don't know what is your interest, they may not be able to work with you as you wish. So let's say you have one research idea. So this is the topic that you would like to suggest. So get a few people of you think. So they may not be interested, they may not be having the same interest with you, but you think may be having the same interest with you. Get a few people, not only one people, maybe 2 or 3 people from the different area, okay, but from the different specialty, but will cover the research area that you want. So from there, you make a brainstorming first, because without that, people don't know how much that you want to do in that particular research. So from that brainstorming, you give idea, they give their opinion. Then from there, you can actually consolidate the earlier idea that you have. It may become a bigger project, or it may become a more focused project from there. To me, that's how we do. So we start with brainstorming first, expand the idea, try to get how else can we do about this research topic. Right. All right. I hope that answers your question.
Yes,
Yeah.
we have a question from the floor. So from Dr. Saiful Ehsan, he mentioned that thank you to all speakers. Prof. Nur Zamzila had mentioned about important role of GRA in research. But I find it's quite challenging to find GRA even when we have grant, especially for research mode when we are from clinical background. Any practical tips how to get good and potential GRA to be under our supervision?
Oh, that is also this is difficult question actually, because even I also sometimes have difficulty to get a GRA. Okay, but one thing is that the source of GRA that you can get, one is try to look for our own trainee lecturer, because sometimes we have our own trainee lecturer looking for grant to start their masters, to start their PhD, but they don't have grant. So try to advertise the grants that you have, that you are looking for a GRA, and then try to get some of our trainee lecturers to be our GRA. So the trainee lecturers may not be just from our kuliah, it may be from the other kuliah, from the field of science, pharmacy, dentistry sometimes. So they may be interested, particularly if the research is like a general things, not particular to one specific area. Like if you do basic science research, maybe those in like health science also want to do that. The kuliah of science also, pharmacy, dentistry, they can also be our student. So from there, I mean, one is training lecturer, and secondly, we can get our previous student to advertise this GRA vacancy to their friends. Usually we can, I mean, they have circles of friends, there are many circles of friends that they can actually help us to advertise the vacancy of GRA post. All right, like mine, the latest one, I have one GRA that I recruited from a student who did industrial practical with me. So I explore her interest and then offer her my GRA position to do my research, and she agrees. So that's how I get one of my GRA students. Maybe Dr. Leila has a different experience to get the GREs. Thank you.
Okay, okay, thank you, Prof. Zam. We have quite a few questions in the chat box. The first one is, I think this is more for Prof. Leila, I think, can answer this question. Thank you to all esteemed speakers. What is your opinion on publication in my site, Index Journal? Is it a good platform or a waste of data, as most of them are not PubMed, Scopus, was indexed? Hence, the citation will be low. So is it worth it to publish our precious data in my site? I think that's the gist of the question.
I myself not really familiar with this, what you call, I'm not so sure about this, right? But if you need to write and you need to submit to a particular journal for publication, just I think my experience, you just start first with the index one, WOS. If not, then the Scopus one. I think that's the side. I mean, aim higher and then go lower. And then if you're not sure about this particular site, then just avoid it.
I see. Perhaps from other speakers, if whoever that has experience with my site, what is your opinion on it? Just to answer the question from the audience.
Okay, let me try to answer these questions. I think it's a very good point by the Dr. Ranji Kau, and Prof. Leila actually have answered it, meaning that you have to go for the Q1, the Q2, Q3, and Q4. That's why some universities like now they only aim for not the Q4 lah, that they want the aim of Q2 or Q3. I think which is like doable. Recently I co-supervised one PhD. Got the idea started from me, whereby that so one area new in Malaysia but not so new in other countries. So to be able to publish in Q1 the most of the papers. I think initially we thought that it's not possible. What made it real? I mean, they're able to be executed because we had, we asked a few experts from UKM, IIUM, the UITM, also the expert we combined together to write the paper. So it's able to publish in high. So from my experience, from my publications, so yeah, it's very difficult to get a citation from MJ, our own journal, Brunei, Singapore, etc. So most of my citation come from others. And I'm sure that Prof. Nasir recently in our meeting, we have have strategized how to make our journal more feasible. Maybe we have our, Dr. Rosina, right? We plan for like Twitter or like the Facebook account. Maybe the younger one go for Instagram and Twitter, right? So make it try to advertise our topic ataupun the journal in the the social media, so that it's more visible, so that we can get more citation. So other my site would be the USM one, UKM pun ada, UPM pun ada, but our publication in those journals susah. But we try Indian not too bad, Indian journal. So Prof. Azrina, we sent to nephrology, we sent to critical care medicine Indian, so not bad in terms of citation.
Thank you, Prof. Basri. So another question from Dr. Aniza Pakir. She mentioned about speaking as a basic science researcher. How do clinicians like to be approached for collaboration? Sometimes we have ideas, but no clinicians are interested to team up. I guess maybe Prof. Basri can enlighten us.
Sorry, I didn't pay attention. What's the question? Okay. Sorry. Yeah.
So, speaking as a basic science researcher, how do clinicians like to be approached for collaboration? Sometimes we have
Okay.
ideas, but no clinician are interested to team up.
Oh, really? Can you give example?
I guess that Aniza Pakir, would you like to?
Yeah. So,
Okay, unmute.
unmute. Okay. I.
Assalamualaikum, Dr. Basri.
Yeah.
Prof. Basri.
I'm not sure whether I'm the right person. You want to ask me or you want to ask Prof. How?
It doesn't matter actually.
Yeah.
Sometimes you have an idea and you approach a clinician
Yeah.
to see if they would like to team up to do something, but you can see that they're not, and they sort of so it just dies there because you can't get samples, you can't do anything. So that proposal just dies, you see.
Okay.
So how do you like? Do you
Yeah, I
like?
think that like what Prof. Zam and Prof. Lela highlighted before, that you need to approach someone who really passionate to do the research. And like me, every day when I do my rounds, so whenever that I got problem and not able to solve the problem, I try to like make into the research questions. All right. So there are many areas that I'm actually glad if the basic medical science to approach me, because not many BMS people approach me. I had to approach them. I approached Prof. Zam earlier to do some studies on interleukin-6 and on procalcitonin, because I don't have the idea how to do it. Metabolomics, we approach the expert, Dr. Alfie, right? There in the College of the Pharmacy, etc. I think your area is quite good, which is like a PCR in the myelodosis. We can do, expand that further for some other infections, because got the expert. Yeah. Okay. Aniza, hope that.
Thank you, Prof. Thank you, Prof.
I don't know. For me, I'm always looking for it. Yeah.
Okay, maybe I can add on how here. I think, yeah, it's always like this lah. Sometimes we are interested in certain thing, but the BMS people are not interested, or vice versa. Of course, this happen. I presume if lecturer A, you approach the lecturer A, not interested, you go for B or C or etc. Unless you are looking at very specific field that, like for example, if we just look at something related to lung, say for example, and then it's either me or Naim. But even me and Naim not interested, actually we should support. Unless the research really may cause some harm to my patient. But if the research doesn't cause any harm, you want some blood or whatever, I think we are much more happy to help. Or not, I mean, I was just talking about any lecturers lah. Okay, they will be just more happy to help, even though they may not be interested in that particular field. So you can even go to the head of department, you say, oh, I approach Naib or me, how is not interested, whether you can find someone else to do or not, because you may not know all the lecture medical department. So the head department probably can open out to the rest. Okay, by right, of course, if you ask me, I'm not interested, I probably will find someone for you. That is the best. But if you really cannot, you can actually go to the HOD and ask HOD, probably can employ someone who may be interested in research, Yeah.
Thank you, Prof. I will try harder.
Yeah. You can ask me, I can help you to get people to
Sure,
do
Prof. I've had the privilege of being mentored by you for research in myelodosis, and it has opened up a lot of avenues for me to meet other researchers, which has been very, very useful. So thank you, Prof.
You're welcome.
Okay, thank you so much for the question, and thank you, Prof. Hao and Prof. Basri, for answering the question. There is another question actually from Dr. Aniza Pakir, but this question will be answered by the head of research herself in her closing remarks later. Okay, there's also a few questions in the background. For this one, for Prof. Zamzila, it's actually about timeline. As a young researcher, we feel pressured to do a lot of things quickly. And you said that we have to prepare early we have to prepare early and plan our activities. Can you give us an idea how long do we need to prepare for grants and deadlines?
Okay, thank you, Dr. Azwanis, for the question. So it is about how long we need time to prepare for a grant. So it actually depends on what grant you want to apply and how big it is and how extensive your project is. So if you want to prepare just a simple project, maybe and you commit yourself to search to prepare the proposal, maybe it will take 1 month. But I think for a bigger project, you really need a lot of searching and here and there, a discussion. So that will take you few months. So that's why I said earlier, you have to be alert with the grant opening and closing, because what you should do is that ideally you should prepare the proposal ahead before the opening of the grant. So let's say you know the FRGS is open when Dr. Rosina, every June.
It's already open. It's closing on the 16th of March.
So now it's January. So if you know that every year FRGS is open in January, so it may be 6 months before the opening of the grant. You are ready. You start preparing your proposal. So by the time the grant is open, you are ready with your proposal. You just submit, and then after that you wait for the correction from the panel. So it depends on you itself. Actually, it depends on you how much effort you put in preparing the proposal and how big the grant that you want to apply. So I remember the first FRGS that I applied, it was in 2010 when we actually have to attend a CLA, competency level assessment, because that time, before we can get promoted to the next level, we must pass the CLA, competency level assessment. So in that CLA 4, I remember we have to prepare a FRGS proposal to the panel before you can pass that competency level assessment. So at that time, we are being forced to prepare. So I took I think at least 3 months to prepare for that FIGS proposal. So and Alhamdulillah, that was my first application for FIGS, and I got that grant. So so when preparing the FIGS, I mean, I really put all my effort to search for the information and get the proposal done on time.
Right. So that means extensive planning ahead of time. So we are looking at months, maybe years even.
Yes, really. Yes, it is. So it depends on
secure success.
Yes, so if you are someone who you need more time, then maybe you can plan about 1 year before that. You have to plan already for your research.
Okay, thank you so much, Prof. Zam. There's another question for actually Prof. Basri. Someone just wants to ask regarding your time management metrics just now. There was a table in your slide. The part that you said that we have to focus more is the matrix number 2. Can you give an example of what kind of activities in matrix number 2?
Okay. When you remember that I also show you the book, the HBR. So the metric number 2 example is what's your long-term plan. You want the publication, right? So that is your maybe how many publication that you want to have in a year. I think 1 is enough. The 1 publication in a year. So in your daily task, you got your some urgent things to do, and then what is the metric number 2 things to do. So from that book guided me that for the metric 2, you cannot put more than 2 objectives at one time. Okay. You must have, so that is macam kalau if you give like for us anesthesia, I mean that is we have our boluses and our infusion, so background, that is our background infusion for long term. So while you are doing your your solving your like other apa tu yang tadi tu dalam quadrant tadi kan macam the agents important. So by the end of 1 month is done. Is done. Example, actually what is important is depends on you for that time. Okay, let's say that you want to buy a car, maybe it's important for you that you're saving money to buy a car. Okay, like what's important for you, maybe you want to get the grant, that Prozam said that so before the grant open, you already planned a few years before that. So that is your coordinate number. So at least that your long-term plan is achieved. Okay? So you want apa lagi ya? So example, you want the 1 or 2 publications. So how you plan? What Prof KY Khalid Prof Khalid KY Kamal Zaman Yunus So Prof Kamal Zaman, before he became the director campus, he was very productive. He wrote a lot of like publications. So one session we invited him to get a talk. So he said that what he did, he just come, he come early 30 minutes of his time, he just spent writing. So of course that after 1 year, that he got the material. So 1 month he able to write 1 article. So just by allocating about 30 minutes in the day before he start other things. Before he start the so that what he. So I last time when I was struggling with my publication, so I also did the same thing. So last time when I was in HDE, my handover start at 8 o'clock. And I sent my kid to school before 7, so I got the 7 to 8 to sit down in my office before I do my round in the ICU. Contoh lah.
So that means we have to identify what is our priority that we want long term.
Yeah.
And then we have to make that our continuous effort should be going for that actually, isn't it?
And I think that the book that sorry that I always not promoting the Western thinker, but one of the book or concept is by Robin Sharma. That he last time I tried is a famous book is a 5 a.m. club. So he also have help you how to strategize for your quadrant number 2 as well.
Okay, thank you so much, Prof. Basri. It's amazing how you can have time to read other types of non-academic books as well. All right, I think it's time for us to conclude. I would like Dr. Shahida to conclude.
We are very grateful to have all these 4 distinguished speakers to spend their precious time guiding us. We hope that this session has brought additional insight to the young lecturers to plan their research afterwards. Now I would like to invite Associate Prof. Dr. Roslina, the Head of Research, to give some closing remarks.
Bismillahirrahmanirrahim. Assalamualaikum and a very good evening, everyone. First of all, I would like to apologize for the shortcomings in the earlier part of our forum. Please accept my apology. Okay. First of all, Prof. Jamal initiated this program. He told me that when I took the job as a HOR last year, so this is his program that we want to do the research mentoring, train the mentor session. So he came out to he's eventually select a few speakers which he thinks have the potential to brush up our new and young lecturers here. So Alhamdulillah, all the speakers have agreed. Thank you so much for agreeing to come and share your experience here today with all of us. May Allah bless all your good deeds. And then after this session, right, I've already requested all the HODs to list down their mentors, potential mentors in their department. Okay, now the new trainee lecturers, the young bees, the newbies, okay? So please go through the list of I will email the list of mentors from all the departments, right? And then you can select, not necessarily you need to have mentor in your department, it can be from other department. I'm actually a byproduct of mentoring. My mentor is Prof. Nazlin, Dr. Zam, when I supervise my student. Alhamdulillah, because of their help, they really helped me in my research activities. So we always have like discussion. If we are not clear, we sit down together and discuss. And don't afraid of failing in your FRGS grant. I failed 5 times before I get my real FRGS grant. Okay, so don't scared of failing. Just keep on trying. Inshallah, you'll be fine. Okay, trust, and then do all the comments that they give you. If the first time you fail, the next time you might you do the amendments, and actually when you do the amendments according to the comment, inshallah the next time you will see the light, okay, under the tunnel. Okay, so I want all of you to think about who are the potential mentors that you want. Okay, pick a mentor, approach the mentor, and then pick a mentor. Okay, let's say you're going to report to my office that you're going to select, for example, if somebody wants to select Prof. How, so okay, this year we want to write a review article together. Okay, so you by December 2022, hopefully you can have a proof that you have already written a paper together with Prof. How. Okay, you can select any of mentee. You want to write textbook, or you want to write research book, or you want to write an ebook, or you want to apply grant together. So please list it down who are your mentor, okay, who is your mentor, and what you're going to do, what project you're going to do with your mentor. So that is what eventually after this program, we want you to select. We don't want to put you to another mentor. So find a mentor that you think you can work with. Okay, you can work with, you can discuss, you're not scared with him or her. Okay, so try select the mentor that you like and you want, and you think have potential to, brush you up and to be somebody great in the research. I hope I don't miss any points. And once again, I would like to apologize for any shortcomings. Inshallah, on the 10th of February, 2 to 5 p.m., we will have FRGS tips and also proposal writing workshop. So I've invited 2 speakers. One is Assistant Professor Dr. Maizura. She have got FRGS twice, and Associate Professor Dr. Hashima. So they will share their tips in applying FRGS. And I've also invited panel, Prof. Basri, Dr. Zam, Prof. Azrina, okay. So I invited a few panels together to evaluate your proposal presentation. So we will email you the detail, what are the things that you need to present to us when you come for the proposal, FRGS proposal submission workshop. So hopefully when you go through that proposal and listen to the advice from the panels, you can brush up your proposal and submit for your FRGS application. There's question, young lecturers do you refer to serve which year, may I know? To be honest, I think I need to learn a lot. So can I be categorized under young lecturers as well, even though I'm the HOR? Okay, so I think I need to improve myself. A lot of things I need to know. So I think knowledge is until you die, you still have to learn. So you can select, Nazira. Yeah, it doesn't have an age limit here. You learn until you die. Okay. So is there anything else? Any questions? I hope please fill up the CPD points. Okay. Please fill up the feedback form and your attendance. Okay. And I'm so sorry for any shortcomings. Can we close our session with Tasbih Kifayah and Suratul As? Thank you so much, everyone, for coming. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Thank you, everyone. Aniza Pakir, I hope I have answered your question. That